You're standing in your kitchen, brewing a cup of tea. It's a simple ritual, comforting, natural. But what if I told you that innocent-looking plant in your cup could be interacting with your prescription medication right now, creating a potentially dangerous chemical reaction inside your body? Today, we're counting down the top 15 healing plants that could save your life or end it. These aren't exotic jungle specimens you'll never encounter. These are plants you can find at your local health food store, growing in gardens, sitting on pharmacy shelves. Common, available, and far more complex than their natural remedy labels suggest. Each plant on this list has been scientifically proven to provide genuine health benefits. But each one also carries hidden dangers that most people never learn about until it's too late. We'll explore the ancient wisdom, the modern science, and most importantly, the standardized danger scores that will help you use these plants safely. So stick with me, because by the end of this video, you'll know exactly which of these healing wonders belongs in your home, and which ones you should approach with serious caution. Let's begin. Number 15. Evening Primrose, Winothera biennis. Danger scores: toxicity, 2 out of 5. Allergenicity, 2 out of 5. Drug interaction, 2 out of 5. The tall stems reach toward the evening sky, topped with flowers of the most brilliant yellow. Flowers that only open as darkness falls. Evening primrose sounds romantic, even mystical, and for centuries, Native American tribes knew its secret. The seed oil of this plant contains something pharmaceutical companies have tried desperately to replicate: gamma-linolenic acid. This omega-6 fatty acid has a remarkable ability to reduce inflammation and balance hormones. Women suffering from brutal PMS symptoms have found relief where prescription drugs failed. People with eczema have watched their skin heal after years of steroid creams. But here's the twist. Evening primrose oil can thin your blood. Not dramatically, not dangerously for most people. But if you're already on blood thinners, if you're about to have surgery, that harmless supplement becomes a hemorrhage risk. The plant itself is easy to spot. Those bright yellow blooms opening at dusk, the lance-shaped leaves, the seed pods that crack open to reveal tiny treasures. Indigenous peoples used every part, from the roots to treat bruises to the leaves for gastrointestinal relief. The warning: evening primrose is relatively safe, but timing matters. Stop taking it at least 2 weeks before any scheduled surgery, and always tell your doctor you're using it. Number 14. Hawthorn, Crataegus monogyna. Danger scores: toxicity, 1/5. Allergenicity, 1/5. Drug interaction, 3/5. A thorny shrub covered in delicate white blooms. In autumn, those flowers give way to deep red berries that birds feast upon. For over 1,000 years, European herbalists have called hawthorn the heart herb. They weren't being poetic, they were being precise. Modern cardiology has confirmed what medieval healers intuited. Hawthorn berries and leaves contain oligomeric procyanidins, compounds that strengthen heart muscle contractions, improve blood flow to the heart, and stabilize irregular heartbeats. Clinical trials have shown it helps patients with mild heart failure, sometimes as effectively as prescription drugs. But there's a dangerous irony here. The very people who need hawthorn most, those with heart conditions, are the ones who must be most careful with it. Because hawthorn doesn't play well with cardiac medications. It can amplify the effects of digoxin, leading to dangerous heart rhythms. Combined with beta blockers, it can drop blood pressure too low. The berries hang in clusters, bright as blood against the thorny branches. They're tart, slightly sweet, and packed with antioxidants. But they're not candy. The warning: if you have any heart condition or take any heart medication, never use hawthorn without direct supervision from a cardiologist. The interaction risk is too high. Number 13. Flaxseed, Linum usitatissimum. Danger scores: toxicity, 1/5. Allergenicity, 1/5. Drug interaction, 2/5. Golden brown and oval, these tiny seeds don't look like much. You can buy them by the pound. Sprinkle them on your morning oatmeal. Blend them into smoothies. They seem as harmless as food gets. Ancient Egyptians thought so too. They've been finding flaxseed in 5,000-year-old tombs. What makes flaxseed special is its triple threat of benefits. Alpha-linolenic acid, a plant-based omega-3, lignans, powerful antioxidants, and soluble fiber. Together, these compounds can lower cholesterol more effectively than some prescription medications. They reduce inflammation. They may even protect against certain cancers. Here's what they don't tell you on the health food store label. Flaxseed creates a mucilaginous coating in your digestive tract. That's great for your intestines, but it can also coat medications, preventing them from being absorbed properly. Take flaxseed with your thyroid medication, you might not be getting your full dose. With antibiotics, same problem. And there's another catch. Flaxseed must be ground to release its benefits. Whole seeds pass through your system intact. But once ground, those seeds go rancid quickly, developing compounds that can cause gastric distress. The warning: always take flaxseed at least 2 to 3 hours apart from any medications. Buy whole seeds and grind them fresh, storing them in the refrigerator. Number 12. Tea tree, Melaleuca alternifolia. Danger scores: toxicity, 4 out of 5. Allergenicity, 3 out of 5. Drug interaction, 1 out of 5. From the wetlands of Australia comes an oil so powerful, so antimicrobial that it's become a billion-dollar global industry. Tea tree oil can kill bacteria, viruses, and fungi that laugh at commercial disinfectants. During World War II, Australian soldiers carried it as a first aid essential. The narrow leaves of the tea tree, more shrub than tree, release this potent oil when crushed. It smells medicinal, sharp, with notes of camphor, and it works miracles on acne, athlete's foot, and infected wounds when applied topically. But here's the terrifying truth. Tea tree oil is one of the most toxic substances on this entire list if swallowed. As little as 10 milliliters can cause confusion, loss of muscle coordination, and coma in an adult. In children, even less. The active compound, terpinen-4-ol, is therapeutic on your skin but catastrophic in your bloodstream. And even topical use isn't without risk. Tea tree oil causes allergic contact dermatitis in a significant number of users. The rash can be severe, spreading beyond the application site. The warning: never, ever ingest tea tree oil. Always dilute it before topical use. Patch test first. And keep it locked away from children and pets. It's toxic to dogs and cats. Number 11. Aloe vera, Aloe barbadensis. Danger scores: toxicity, 2 out of 5. Allergenicity, 2 out of 5. Drug interaction, 2 out of 5. Break open one of those thick, succulent leaves and clear gel oozes out. It's cool to the touch, soothing. For sunburns, cuts, and skin irritations, aloe vera gel is legendary. Ancient Egyptians called it the plant of immortality and placed it in pharaohs' tombs. The gel contains over 75 active compounds, including acemannan, a polysaccharide that accelerates wound healing. It's anti-inflammatory. It's moisturizing. Applied topically, it's wonderfully safe for most people. But there's a dark side to this desert plant. The yellow latex that seeps from just beneath the leaf's skin contains aloin, a compound that's a powerful laxative. Too powerful. Long-term use of aloe latex has been linked to severe diarrhea, electrolyte imbalances, and even kidney damage. Some studies suggest it may be carcinogenic. Even the gel isn't innocent when ingested. It can lower blood sugar dramatically, dangerous for diabetics. It can interact with heart medications, amplifying their effects. And because it affects potassium levels, it becomes especially risky for anyone with kidney problems. The warning: use pure aloe gel topically with confidence, but avoid aloe latex entirely, and never take aloe internally if you're on heart medications, have diabetes, or have kidney issues. Number 10. Ginseng, Panax ginseng. Danger scores: Toxicity, 2 out of 5. Allergenicity, 1 out of 5. Drug interaction, 3 out of 5. The root looks like a tiny human figure. Arms, legs, a body. For over 5,000 years, Chinese medicine has revered ginseng as the king of herbs, believing that resemblance to human form indicated its power to treat the whole body. They weren't entirely wrong. Ginseng root, gnarled and light brown, contains unique compounds called ginsenosides. These molecules adapt to your body's needs, hence the term adaptogen. Stressed? Ginseng can calm you. Fatigued? It can energize you. Low immunity? It strengthens your defenses. Clinical studies confirm it improves physical stamina, mental clarity, and immune response. But there's a reason traditional Chinese medicine warns against overuse. Ginseng can stimulate the nervous system too much, causing insomnia, rapid heartbeat, and anxiety. More concerning, it can interfere with blood sugar medications, causing dangerous drops in glucose. And it has mild blood thinning properties that become dangerous when combined with anticoagulants. The root takes 4 to 6 years to mature, which is why quality ginseng is expensive. The older the root, the more potent, and the more careful you need to be. The warning: don't use ginseng if you're on diabetes medications or blood thinners. Limit use to 2 to 3 months at a time, then take breaks. And avoid it entirely if you have high blood pressure. Number 9. Peppermint, mentha times piperita. Danger scores: toxicity, 1/5. Allergenicity, 2/5. Drug interaction, 2/5. The serrated leaves release their unmistakable scent at the slightest touch. Sharp, cooling, invigorating. Peppermint is so common, so universally used, that we forget it's actually medicine. Yet menthol, its primary active compound, is clinically proven to relieve digestive discomfort, ease tension headaches, and clear congested sinuses. Ancient Romans scattered peppermint leaves at feasts to aid digestion. Modern research confirms they were onto something. Peppermint relaxes the smooth muscles of the gastrointestinal tract, reducing spasms and bloating. But here's the catch: that same muscle-relaxing action can be problematic. For people with gastroesophageal reflux disease, GERD, peppermint actually makes things worse by relaxing the valve between the stomach and esophagus, allowing acid to flow upward. The relief you seek becomes more pain. And peppermint essential oil, concentrated and potent, can cause allergic reactions, skin rashes, breathing difficulties. Applied directly to the face, it can cause breathing problems in infants and small children. The plant itself spreads aggressively, purple-tinged stems creeping through gardens, taking over whatever space you give it. Perhaps that's a metaphor for its effects. The warning: avoid peppermint if you have GERD or hiatal hernia. Always dilute essential oil before topical use. Never apply near the face of children under 3. Number 8. St. John's wort, Hypericum perforatum. Danger scores: toxicity, 2 out of 5. Allergenicity, 1 out of 5. Drug interaction, 5 out of 5. Bright yellow flowers bloom in midsummer, 5 petals each, with tiny translucent dots that look like perforations, hence perforatum. Hold a leaf up to sunlight and you'll see those dots glowing. Medieval Europeans thought they were proof of divine blessing. This plant, they believed, could ward off evil spirits. What it actually does is increase levels of neurotransmitters in the brain: serotonin, dopamine, norepinephrine. Clinical trials have proven St. John's wort as effective as prescription antidepressants for mild to moderate depression. The active compounds, hypericin and hyperforin, create measurable mood improvements. And here's where this plant becomes one of the most dangerous on our list. St. John's wort induces liver enzymes that break down dozens of medications. Birth control pills? It makes them less effective. Unwanted pregnancies have resulted. Antidepressants? Dangerous interactions causing serotonin syndrome. Blood thinners? Reduced effectiveness. Immunosuppressants for organ transplant recipients? It can trigger rejection. The list of dangerous interactions is so long that many pharmacists advise against using St. John's wort entirely if you're on any prescription medication. The warning: never combine St. John's wort with prescription antidepressants. If you're on birth control, use backup contraception. Better yet, avoid this plant if you take any regular medications. The interaction risk is simply too high. Number 7. Ginkgo. Ginkgo biloba. Danger scores: toxicity, 2 out of 5. Allergenicity, 1 out of 5. Drug interaction, 4 out of 5. A living fossil. That's what botanists call this tree. Ginkgo biloba has existed, virtually unchanged, for over 200 million years. It survived the ice ages. It survived the asteroid that killed the dinosaurs. Individual trees can live for over 1,000 years, their fan-shaped leaves turning brilliant gold each autumn. Those leaves contain ginkgolides and bilobalides, compounds that increase blood flow to the brain and act as powerful antioxidants. Research shows ginkgo can improve memory in people with age-related cognitive decline and may slow the progression of dementia. It's one of the most extensively studied herbal remedies in modern medicine. But ginkgo's ability to improve circulation comes with a dark side. It's a blood thinner, a strong one. Combined with aspirin, warfarin, or other anticoagulants, it can cause serious bleeding. There are documented cases of brain hemorrhages linked to ginkgo use. The tree itself is remarkable. Some specimens in China are over 3,500 years old. But those foul-smelling seeds? They contain a compound similar to poison ivy that causes severe allergic reactions. The warning: stop taking ginkgo at least 2 weeks before surgery. Never combine it with blood-thinning medications. And if you bruise easily or have a bleeding disorder, avoid it entirely. Number 6. Lavender. Lavandula angustifolia. Danger scores: toxicity 1.5, allergenicity 2.5, drug interaction 1.5. Purple flower spikes rising from gray-green foliage, releasing a scent that is somehow both calming and invigorating. Lavender fields in Provence, France, have become tourist destinations, thousands of acres of purple undulating in the breeze. But this Mediterranean native is more than just pretty. The essential oil contains linalool and linolyl acetate, compounds that measurably reduce anxiety and improve sleep quality. Clinical studies show that inhaling lavender oil lowers heart rate, blood pressure, and cortisol levels. It's one of the few essential oils with solid scientific backing for its calming effects. Lavender is remarkably safe, which is why it appears lower on this countdown. But safe doesn't mean harmless. The essential oil can cause skin irritation and allergic reactions in some people. More concerning are recent reports of hormonal effects, specifically some cases of prepubertal gynecomastia, breast development in young boys, have been linked to lavender oil exposure. And while lavender oil itself doesn't interact significantly with medications, its sedative effects can amplify the effects of sleeping pills and anti-anxiety drugs. The warning: always dilute lavender essential oil before topical use. Avoid prolonged exposure in young boys, and be cautious combining it with sedative medications. Number 5. Echinacea. Echinacea purpurea. Danger scores: toxicity 1/5, allergenicity 3/5, drug interaction 2/5. The purple coneflower stands tall in prairie grasslands, its spiky orange center surrounded by drooping purple petals. Native American tribes used every part of this plant: roots, leaves, flowers, for infections, wounds, and snake bites. They called it the cure-all plant. Modern immunology has revealed why. Echinacea contains echinacoside and saccharic acid, compounds that stimulate white blood cell production. Clinical trials show it can reduce the duration of colds by 1 to 2 days and may prevent infections when taken preventatively. Here's the problem: That immune-stimulating power makes echinacea dangerous for people with autoimmune conditions. If your immune system is already attacking your own body, as in rheumatoid arthritis, lupus, or multiple sclerosis, echinacea can make things worse. And then there's the allergy issue. Echinacea is in the Asteraceae family, along with ragweed, daisies, and chrysanthemums. If you're allergic to any of these, echinacea can trigger severe reactions, rashes, breathing difficulties, even anaphylaxis. The warning: never use echinacea if you have any autoimmune condition. If you have seasonal allergies to ragweed, avoid it entirely. And don't use it continuously. Take it only at the first sign of a cold, for no more than 10 days. Number 4. Chamomile. Matricaria chamomilla. Danger scores: toxicity, 1 out of 5th. Allergenicity, 3 out of 5th. Drug interaction, 3 out of 5th. The tiny white flowers with their yellow centers look like miniature daisies, and when you crush them, they release a scent of apples and honey. For thousands of years, chamomile tea has been the go-to remedy for anxiety and insomnia. Your grandmother made it, her grandmother made it, ancient Romans made it. The active compound, apigenin, binds to receptors in your brain that reduce anxiety and promote sleep. It's not a placebo. Studies using EEG readings show measurable changes in brain activity after chamomile consumption. It also has genuine anti-inflammatory effects on the digestive system. But chamomile is another member of the Asteraceae family, and the allergy risks are significant. For people sensitive to ragweed, chamomile tea can cause throat swelling, difficulty breathing, and severe allergic reactions. More insidiously, chamomile can interact with blood thinners like warfarin, increasing bleeding risk. It can also affect how your liver metabolizes certain medications, including cyclosporin, used to prevent organ rejection. Those harmless-looking flowers in your bedtime tea, they're processing through your liver, changing how your body handles other drugs. The warning: if you're on blood thinners or immunosuppressants, skip the chamomile. If you have ragweed allergies, 1 cup could send you to the emergency room. Number 3. Garlic. Allium sativum. Danger scores: toxicity, 1/5. Allergenicity, 1/5. Drug interaction, 4/5. Peel away the papery white skin and you'll find cloves that have been cultivated for over 7,000 years. Every ancient civilization used garlic. Egyptians fed it to pyramid builders for strength, Greek athletes ate it before the Olympics, and Roman soldiers consumed it before battle. They all knew something powerful lurked in those pungent bulbs. Modern science has confirmed it. When you crush garlic, an enzyme converts alliin to allicin, a sulfur compound with remarkable properties. It lowers blood pressure as effectively as some medications. It reduces LDL cholesterol. It has antimicrobial effects strong enough to kill antibiotic-resistant bacteria. Regular garlic consumption is associated with reduced cancer risk. But allicin is also a powerful anticoagulant. Combined with blood-thinning medications, garlic can cause serious bleeding. There are documented cases of spontaneous bleeding, spinal hematomas, excessive surgical bleeding, in patients who didn't disclose their garlic supplement use. And here's something most people don't know. Those odorless garlic pills, they've removed the allicin, which means they've removed most of the beneficial effects too. You need the stink to get the benefits. The warning: if you're on blood thinners or scheduled for surgery, stop eating raw garlic or taking garlic supplements at least 2 weeks before. The interaction risk is serious. Number 2. Ginger. Zingiber officinale. Danger scores: toxicity, 1/5. Allergenicity, 1/5. Drug interaction, 2/5. The knobby beige root looks unremarkable until you cut into it, revealing bright yellow flesh that burns your tongue with spicy heat. For 5,000 years, ginger has been treasured in Asian medicine, not for seasoning food, but as powerful medicine. Break that root down to its molecular components, and you find gingerol, a compound structurally similar to capsaicin, but with broader effects. It's phenomenally effective against nausea. Studies show it works better than prescription anti-nausea drugs for morning sickness and chemotherapy side effects. It reduces inflammation in arthritis patients. It can lower blood sugar and cholesterol. Ginger is low on this list because it's relatively safe, but relatively is the key word. Like garlic, ginger has anticoagulant properties. The difference? Ginger's blood thinning effect is milder, but combine it with aspirin or other blood thinners, and you've created a cumulative effect that can cause bleeding. Fresh ginger, dried powder, tea, supplements, all effective, but also all capable of causing heartburn, diarrhea, and mouth irritation in high doses. The warning: ginger is generally safe, but don't exceed 4 grams per day. If you have a bleeding disorder or you're on anticoagulants, use it cautiously. And stop all ginger products 1 week before surgery.